Anemia, causes and symptoms.
This is our group's presentation on anemia and its causes and symptoms.
I'm Alex.
I'm Sophia.
I'm Sam.
I'm Marilyn.
I'm David.
I'm Cameron.
I'm Christian.
So, introduction to anemia. Nutritional anemia is one of the most prevalent and preventable diseases in third world countries. It occurs when the blood has low RBC counts, or low red blood cell counts, and it usually is caused by lack of iron, B12 vitamin, or folic acid. Deficiencies usually occur from lack of dietary needs, problems absorbing nutrients in the small intestines, and or chronic blood loss. It usually presents itself with a variety of symptoms. However, it's often misdiagnosed since the symptoms are very common in many diseases. The disease is extremely preventable with proper care. So if you might have anemia, go seek professional help at your local doctor.
So we find the high-risk area of anemia in Nigeria. The worst affected cities are in the southmost and the southwest, and the central, which is the federal capital territory, and its surrounding cities. This distribution of many cases is actually not due to the low education level or insufficient income to sustain life.
Industrialization has led to excessive carbon dioxide emissions, which has weakened the human immune system and reduced the nutritional values of crops, and malabsorption has caused people to suffer from anemia. Lack of nutrients leading to deficiency due to lack of iron, vitamin B12, and folic acid, common in areas with poor food nutrients.
Causes of anemia. Many common causes are seen in deficiencies such as the vitamin B12 and iron and folic acid deficiencies that are seen in children who aren't getting enough to eat or don't have proper diets that maintain to keep their vitamin levels sufficient for their bodies. In instances of malnutrition, it's difficult to fit your diet without proper education, and it's seen in many cases that these children are simply not eating properly enough. While most cases of anemia are seen in children, it's also seen sometimes in mothers and their children, their newborns, who are born prematurely. Their blood cells may be deteriorating too fast, and it can also be seen in children who lose too much blood.
Here are some common symptoms of anemia that include fatigue, weakness, dizziness, shortness of breath, spleen enlargement, jaundice, and irregular heartbeat. These symptoms can vary for multiple reasons, whether it be in terms of mild, severe, or moderate anemia, as well as what they lack, which is iron, B12, or folic acid. They also vary based off of gender and age. So for example, in women, it is worse because they experience a menstrual cycle, or if they are pregnant, these symptoms may become worse.
So, like Sophia said, symptoms tend to vary based on different demographics. For example, in children, they're seen more irritability, grouchiness, mental and physical delays, and learning issues. In pregnant women, the RBC levels and hemoglobin levels drop drastically after pregnancy, as well as symptoms becoming much more severe. And people with underlying health conditions, especially chronic blood loss or blood cancer, they tend to have more continued symptoms even after nutritional supplements, more severe symptoms, and long-lasting anemia.
A person with anemia may have weakness, shortness of breath, or memory loss. The burdens of healthcare systems in Nigeria include shortages of resources and deficiency in development labor, inadequate repair and maintenance. The little money they receive due to a low government budget results in this deteriorating medical infrastructure. Nigeria has 20 nurses, doctors, midwives for over 10,000 people.
Touching back on what Cameron said, anemia symptoms can often sometimes lead to lack of cognitive development and lack of productivity within school. So if children have anemia symptoms, it can affect them greatly in school. And it can also add a huge stress on parents because they may not know what's going on with their child, and you know, they just keep taking their child to school without knowing what's going on.
Here's our community workshop. So one major issue with anemia is that many people are not educated about it, and oftentimes it goes undiagnosed, and the symptoms are overlooked because they are so similar. So our goal was to educate, inform, and make people more aware. And we did this by making 2 workshops, one of which was a matching puzzle, and another was planting arugula plants. So our first exercise, our first workshop was a matching puzzle. So like any other puzzle, you put together the pieces that have the proper cutouts that fit together to make a larger image that is usually provided as the finished product. So as you can see at the top left, that is our image that they should be seeing. So the audience will have 8 stations, so they should be divided into groups evenly. It is a simple activity that is fun and stimulates the brain, and it causes a really warm environment and fosters a healthy environment for group work while still staying on task.
Now for our second exercise, we did an arugula plant workshop. So for many people in Nigeria, they don't have access to proper foods that have high iron, folic acid, or B12 vitamin. Arugula is probably one of the perfect plants to grow in Nigeria because it can withstand really high temperatures, reaching 90 degrees, and it also has a relatively short growing period. So for the workshop, the administrator will provide some background information, like basically explaining symptoms of anemia, and then afterwards, we provided instructions to say how to grow it, as well as ways to take care of it at home. So this is a take-home workshop where the participants will be able to bring their plant home and grow it and eventually use it to eat. And our end goal was to have participants understand what the symptoms of nutritional anemia are, know when they should go to the doctor for it, and giving participants their own way for presenting symptoms to present in the first place.
This is our budget that we're going to use for all these workshops. We're going to use these materials, and the total should come out to $373.17. And then the remaining budget will go to the Hunger Project.
Okay, so handout. So we also came out with a game called Connections, which teaches little children and women about foods that are high in folic acid, vitamin B12, and iron. Foods like red meat have a lot of iron, such as also leafy greens. And we also provided a definition, like a brief description about what iron, vitamin B12, and folic acid is. So these people can implement these foods in their day-to-day diet.
Right next to it is an infographic that contains the symptoms and causes. Symptoms such as yellow hands, dizziness, and chest pains, and causes such as inherited through pregnancy, not eating enough vegetables, or not eating enough red meats, which goes hand in hand with the matching.
And these are all the research that we used.
And thank you.